first type of restraint we're going to look at today is a foam level 1 single Velcro restraint. These can be used on a patient's wrists or ankles. They are single patient use and come in packages of 2 in your supply pixes. To apply the restraint, the soft blue sponge portion is placed around the patient's wrist. The Velcro is then attached and the safety lock is snapped, leaving a 2-finger width distance between the patient's wrist and the restraint. Next, we will apply the quick release device to the bed frame, being careful not to attach this device to the bed rail or any other movable parts of the bed. The patient's wrist restraint may then be snapped to the quick release device and pulled snugly to secure the patient's wrist. It is important to remember that both parts of the level 1 restraint are considered to be one unit, and if both parts are not in use, then both parts must be completely removed from the patient's bed, and the patient's room. The next restraint we're going to look at is a mitten restraint. Mittens can be used when you specifically need to restrain a patient's fingers or hands. To apply the mitten, the patient's hand is placed inside of the mitten, separating the fingers into the finger holes. The restraint is applied around the patient's wrist and the Velcro is secured, allowing easy 2-finger access into the mitten. Velcro is then applied across the patient's knuckles to restrict the movement of the hand. Mittens are not to be tied to anything unless a separate order for wrist restraints has also been obtained. The next type of restraint that we will use is known as the freedom splint. A freedom splint allows a little more flexibility because it does not restrain the patient's wrist. The patient still has arm movement but is unable to bend at the elbow to grab lines or other objects that may be critical to his or her care. To apply this device, you place the freedom splint close to the patient's axilla on the arm that you wish to restrain. The edges are pulled together and secured snugly with straps of Velcro. Care must be taken not to over-tighten the straps or it will reduce the blood flow to the patient's arm. Once the freedom splint is in place, the patient does not have the ability to bend his or her arm at the elbow. It should also be noted that the freedom splint can be used as a positioning aid for patients in which contractures are a problem. If this device is being used as a positioning aid, it will be documented as such in both the physical therapy and occupational therapy notes and does not need to be documented as a restraint by the nursing staff. On occasions, patients may be very strong and break the foam level 1 single Velcro restraints, or they may demonstrate violent behavior that may necessitate a stronger restraint for the patient. In these situations, we use neoprene double Velcro restraints. The neoprene double Velcro restraints come in sets of 2. Red for the ankles, blue for the wrist. They are single patient use but are non-disposable. They may be obtained in the nursing resource office. Keep in mind that security may bring level 2 restraints to the unit when called to do so, and they may help restrain the patient while the restraints are applied, but security may never directly apply any type of restraint to any patient. Once the neoprene double Velcro restraints become soiled or discontinued, remove the entire set from the patient, place into a clean pillowcase, tie loosely, and put into a laundry bin. There they will be cleaned, sterilized, and recycled back to the nursing resource office. Both ankle and wrist neoprene level 2 double Velcro restraints work in the same way with one simple difference. The red ankle restraints only have one strap with which to secure the legs. The blue wrist restraints have two straps for securing the patient. To apply level 2 restraints to either the patient's wrist or ankle, the restraint must be opened all the way and the soft side placed on the patient's skin. The Velcro is then folded over onto the patient's skin with black to black and red to red or blue to blue, followed by securing of the safety snap device, leaving a 2-finger distance width between the skin and the restraint device. To attach the neoprene wrist restraint to the bed, take the straps in opposite directions and secure them to the bed frame. Once again, avoiding attaching the restraint to the side rails or any movable portions of the bed. Once the neoprene restraints have been placed on the patient's ankle, the single strap may then be attached to the bed frame in any area that provides the most patient restraint. A patient who has on neoprene double Velcro restraints on both ankles and wrists are said to be in 4-point restraints. The last restraint device we're going to look at today is called the roll belt or lap belt. The roll belt is to be used only on a patient that is already in restraints on both hands and both ankles. The roll belt is often referred to as the 5th restraint. It is the last restraint to be applied and the first restraint to be removed once the patient is no longer in need of restraints. To apply the roll belt, the belt is taken from the packaging and the quick release clasps are removed from each end of the straps and laid to the side. Place the roll belt over the patient's bony pelvis and turn the patient onto his or her side. Without bending or wrinkling the straps, feed the strap underneath the patient, remembering to keep the strap smooth against the patient's skin. The strap is then taken through the loop on the opposite side of the patient's roll belt. The second strap is then pushed through the opposite side of the patient. The strap is then fed through the second loop. And both straps are pulled snugly to secure the patient's pelvis in the restraint. The quick release device is then attached to the bed frame directly below the patient's pelvis, being mindful not to attach to a bed rail or any other moving portion of the bed. The straps from the restraint device are then snapped into the quick release. It is important to remember that the roll belt serves the purpose of immobilizing the patient's pelvis and should never be placed over a patient's soft tissue such as the abdomen or pelvis or over the patient's chest, as breathing difficulty may arise.